Hey everyone, we've got another heart today. This is number 47 in our collection. And we'll start off with a quick teaser or preview of the main phenotypic feature of this heart. And here you can see that we've got the lungs and the airway attached. And immediately you'll notice that the apex of this heart is pointing to the right. When we look at this right lung here, it's got 1, 2, 3 lobes. When we look at the left-sided lung here, it's got 1, 2, 3 lobes. So we have 2 3-lobed lungs. And then when we look at the trachea and then the bronchus is here, we can see that the tracheobronchial angle appears to be equal on both sides, consistent with right isomerism. So it looks like we'll be dealing with a heart that has right isomerism. And if we were to do a complete preview or a teaser, we would end up going through the whole heart. So I'm just going to put the heart back as how it would have sat in the chest so we can get oriented, and then we can go through the actual intracardiac anatomy now that we know that we're going to be dealing with right isomerism. So the heart would have sat in the chest like this, and of course the lungs and the airway. We already know that we have 2 3-lobed lungs. The anterior surface of the heart is pointing towards the screen, the posterior surface towards the turntable, left over here, right over here, head are superior up here, legs are inferior over here. Now let's go ahead and move the lungs a little bit. And now let's go ahead and try to find the atria. And here we find an atrial appendage, which is on the left side, but looks broad-based or triangular in shape. And when we open up this atrium here, which is a left-sided atrium, we find that there's actually pectinate muscles that spill outside the confines of the appendage. You can see that here nicely as well. All consistent with a morphologic right atrium. So we have a left-sided morphologic right atrium. You can see there's an atrial strand here, and what appears to be a true atrial septal defect, an oval fossa defect, and what appears to be an atrioventricular septal defect here, with a common atrioventricular junction with a common atrioventricular valve. On the other side of this septal strand here, we find another atrium over here. So let's see if we can go ahead and open that up. Here is the second appendage, which also looks broad-based and triangular in shape. And now when we open this one up, we find once again that there's pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. So both the right-sided and left-sided atria are in fact morphologically right. And remember, that's determined by the pectinate muscles, which are the most reproducible finding, rather than the external shape and appearance of the atrial appendages, because as we've talked about before, those could change in shape or size due to hemodynamic change or surgical manipulation. And now from the right-sided morphologic right atrium, here we can see the atrial septal strand. Here's what appears to be a true atrial septal defect or an oval fossa defect. And then here is the atrioventricular septal defect, and here's that common atrioventricular junction. So now let's go back to the left-sided morphologic right atrium here. And here is the common atrioventricular valve. It's hard to tell if this has any direct septal connections because it appears that there's only one ventricle. And it does appear that this is a indeterminate solitary ventricle. And when we look on the posterior aspect of this heart, we can see that there appears to be no other dissected out chamber. And so this is a solitary indeterminate ventricle. And immediately we see that we do have one outflow tract here. And then we have what appears to be a second outflow tract here. So far we know that this heart has right isomerism. It does have two morphologically right lungs. It has an airway with two bronchuses that have right-sided tracheobronchial angles. And we've now got a common atrioventricular junction that opens up into a solitary indeterminate ventricle. And if there's truly only one ventricle, you cannot assign ventricular sidedness or handedness. And of course, then there's double outlet from this solitary indeterminate ventricle. So when we look at this big outflow tract here, we do find that there is a 3-leaflet valve, 1 leaflet here, 2, 3, with 3 sinuses, 1, 2, and 3. Note that this valve is entirely supported by muscle. There is no fibrous continuity with this common atrioventricular valve here. There is muscle interposing here. Once again, note that there's triangles, interleaflet triangles between the fibrous valvar leaflets here. And when we look at this valve here, we do find that there are coronary ostia. There's one over here. There's one over here as well, and there appears to be a second coronary ostia right here as well from that same sinus. So we find 3 coronary ostia between 2 sinuses, one here, and then finally one over here. So this does appear to be an aortic valve, and then that would make this the ascending aorta. That would make this the transverse arch here, leading into the descending aorta. So then we must ask, where is the pulmonary trunk? And it appears that there is a second outlet to this ventricle here. And if we pass our probe through that, we can flip over the heart. And when we do that, we find that there in fact is a hypoplastic pulmonary trunk here that leads to the branch pulmonary arteries. Now, as we go through this heart as well, we come across the pulmonary veins. And you can see the pulmonary veins draining into this confluence here, which did ultimately drain into a vertical vein that drained into the superior caval vein. So there is total anomalous pulmonary venous connection as well. And then what we haven't found yet is a superior caval vein. And here appears to be a superior caval vein here that drains into the left-sided morphologic right atrium. So we have a left-sided superior caval vein that drains into the left-sided morphologic right atrium. So to highlight everything again, we've got a heart with right isomerism, with a right lung that has 3 lobes, 1, 2, 3, a left lung with 3 lobes, 1, 2, 3, an airway with equal tracheobronchial angles bilaterally, a left-sided morphologic right atrium, a right-sided morphologic right atrium as defined by pectinate muscles that spill outside the confines of the appendage, a common atrioventricular valve that allows both the atria to drain into a solitary, indeterminate ventricle, which is double outlet, with a hypoplastic pulmonary valve and pulmonary trunk, which is back here, posterior to a larger aorta here. So an interesting specimen.